Hi, Dr. TJ Miller here. In this video, we're going to talk about how to properly brush your teeth. We recommend a technique called the Bass technique. This is an ultra soft toothbrush that we recommend. It is called the Nimbus for those of you who might be interested in it. But we come in at a 45-degree angle with the bristles kind of locked in at the gum line. The motion is this small circle, and if I do it really slowly, you'll see the bristles don't move. So you're moving this like that, forward one tooth at a time. Again, forward one tooth at a time. And you get to the canine right here. On the back edge of that brush, you would go from this point to here. Now, with the front edge of the brush on the canine. We don't want you to go tooth by tooth over the canine in case you would abrade the gum itself, or like also the tooth. We don't want you to create any abrasion on the teeth themselves, but you would continue around using that small circular technique. An alternative to the circular technique is a jiggle, and that is to come in and do this as opposed to the circle. Now, it is just flexing back and forth, and then you'd move forward a tooth at a time, like so. You would do the same thing on the tongue sides, where you would have the bristles adapted, and again, jiggle, jiggle, or the circular motion, whatever you feel like you can do best. But again, it's not a scrubbing technique. We don't want these circles to be crossing over the gum line. The whole idea with this technique is to introduce the bristles, the tips of the bristles, a little bit below the gum line to dislodge the plaque that's found there. The lower, instead of pointing up, you would be pointed down at a 45-degree angle. And again, small circle, coming forward. Again, up to the canine with the back edge of the brush, and then coming to the front, just constantly overlapping where you've been, moving a tooth at a time. The lower tongue side is honestly the hardest area to get to. You've got to keep the brush, the whole length of the brush, adapted like so. And if you notice, I'm almost hitting the front teeth. So you keep it adapted, moving a tooth at a time with either your circular technique or the jiggle. When you get around to the front teeth, the brush is most often too large for people to get this and have it adapted completely on the tongue side. You can rectify that with a smaller head brush, like what's referred to as a compact head, or you can split the brush so you have maybe 2/3 of the head or 3/4 of it behind the front teeth. And again, bring it in at a 45-degree angle and doing the jiggle or the little circular movement. The idea, again, being that you're trying to get the bristles into the gum line like that, okay? That's the Bass technique. Have a good day.